In this video, we shall learn how to apply CPAP on a baby. For applying CPAP, we need CPAP machine with humidifier, central oxygen supply or oxygen cylinder, source of compressed air and blender, CPAP circuit, adequate size caps, nasal mask, nasal prongs, interface and distilled water. CPAP may be indicated in babies with respiratory distress and recurrent apneas. Before placing a baby on CPAP, clean the CPAP machine with 2% glutaraldehyde or any other surface disinfectant. The heater wire and the temperature probe is cleaned using soft cloth and 70% isopropyl alcohol. First, connect the CPAP machine to the air supply and the central oxygen supply. Hand washing is important before circuit attachment. Wear sterile gloves. Open the disposable CPAP circuit and fix the water chamber onto the servo humidifier. Fill the water chamber with distilled water so that the oxygen delivered is humidified and warm. Use the autofill method for filling the water chamber with distilled water. Fill the bubble chamber with distilled water till the marking and fix it in the slot available in the CPAP machine stand. Connect the safety device between the water chamber and the flow meter using the green colored tubing. The blue color signifies the inspiratory tubing, the one end of which is connected to the water chamber and the other end is locked with the white expiratory limb. The other end of the expiratory limb is connected to the bubble chamber. Fix the heater wire and the temperature probe to the appropriate color-coded slots on the humidifier and the inspiratory circuit. Switch on the humidifier. The flow rate is set at 5 liters per minute and the pressure is selected by inserting the graduated expiratory tube in the bubble chamber. Observe if the bubbles are coming out in the bubble chamber, and in case there are no bubbles, look for any leak in the circuit. Wait till the temperature of the humidifier rises to a desired range of 35 to 39 degrees Celsius before connecting the patient to the CPAP. Measure the size of the nasal prongs or the mask using the nose guide provided in each packet. Select the appropriate sized prongs so that it snugly fits into the nasal cavity and has appropriate inter-ear distance. Measure the cap from the midline of the forehead around the head to the nape of the neck and then back to the middle of the forehead. Do not use head circumference for cap size. Place the cap onto the baby's head, ensuring that the ears are in normal position. Ensure that the cap is pulled down over the ears and down to the nape of the neck. Apply a skin-friendly adhesive tape and a piece of cotton on the overlying skin. Now connect one end of the interface with the appropriate size mask and the other end to the circuit. Secure the interface to the CPAP cap at the level of the forehead and the cheeks. CPAP is considered adequate if the baby is comfortable, has a saturation in the range of 91 to 95%, respiratory distress is nil or minimal, and there is bubbling in the bubble chamber. While the baby is on CPAP, please note that the bubbles should be seen during both inspiration and the expiration phase. Always attach a pulse oximeter and adjust the FiO2 based on saturation, which should be maintained between 91 to 95%. Depending on the severity of respiratory distress, adjust the CPAP pressure so as to minimize the retraction. While changing the CPAP pressure, the flow rate should always be kept constant. Insert a orogastric tube, the open end of which should always be above the level of stomach, to constantly deflate it. Change the position of the baby every 3 to 4 hourly and inspect for any excessive nasal secretions as well as evidence of nasal injury in the form of blanching, hyperemia or erosion of the underlying skin. Nasal injury is graded as stage 1, stage 2 and stage 3 injury. Stage 1 is presence of non-blanching erythema on an otherwise intact skin. Stage 2 is the presence of a superficial ulcer or a erosion or partial thickness skin loss. Stage 3 refers to the presence of necrosis with full thickness skin loss. Thank you.